Hi, I'm Piasecki, OrthoCarolina Sports Shoulder and Elbow Fellowship Director. If you're a fellowship applicant, on behalf of all of us in our Sports Medicine Center, let me congratulate you on getting to this point in your careers. It has taken a lot of resolve to get where you are, and we truly respect and appreciate that. We're privileged to have you take a look at this fellowship. This is what we think is a very special place, and I'm hopeful that this introduction will give you some useful information in your decision-making process. This is obviously a very tricky year with COVID. The application process is totally different for all of us, being largely virtual, and we've tried to put absolutely as much information online as we possibly can. But if there are questions that come up in the process, please reach out to us. We really are here to try to answer as many questions as we can. We want to get to know you as best we can as well, so we get the best fit. So as I introduce the program, there are two fundamental characteristics, I think, which define the program. And the first is the clinical environment that we find ourselves in. Now, in introducing our program, I think there are a couple different elements to this that I think are worth pointing out. First is where we are. In Charlotte, North Carolina, this is the 15th largest city in the United States. We sit midway between the Atlantic Ocean and the Appalachian Mountains. We have a metropolitan population of more than 2.5 million and are actually the third fastest growing major U.S. city. And it's not hard to see why when you look around. This is a beautiful and very active place to live. We have mountains, rivers, and beaches, the Outer Banks being some of the most beautiful and famous coastline in the country. And that produces a very large population, everybody here being active year-round and playing sport at all different levels. If you combine that with interstates and a rapidly growing microbrewery scene, this all feeds into a level 1 trauma center that produces a high volume of highly complex injuries. Our group here, OrthoCarolina, which services that level 1 trauma center and has a very well-established regional presence, is the largest private academic orthopedic subspecialty group in the U.S. We are faculty on an atrium health residency, an orthopedic residency, which is one of the top-ranked residencies in the country. We have a dedicated research institute here and 6 OrthoCarolina subspecialty fellowships, all of which are top-ranked for the very reasons I just mentioned. We have a tertiary care center relationship with all the surrounding facilities, including the level 1 trauma referrals and a multi-state referral network that ultimately produces a very high volume of both standard sports cases as well as complex primary and revision cases, including multiligamentous knee reconstructions, cartilage restoration, complex shoulder and elbow trauma, and arthroplasty, as well as hip arthroscopy. I think that's the holy grail of clinical environment for fellows, is to try to find a place where you have a high volume of bread and butter cases, but also a very high volume of high complexity cases. So the second feature that really makes us stand out, I think, is our faculty. Our primary fellowship faculty are shown here, and you'll notice a couple of things about us. The first is that we showcase very diverse training backgrounds, which is intentional to give the fellows multiple different perspectives on the same problems. Pat Connor, for instance, in the upper right, did his shoulder and elbow fellowship training at Columbia as well as at the Mayo Clinic, while both Jonathan Rebo and I did fellowships at Rush. Jim Fleischle at the upper left trained with Jim Andrews at ASMI. Shad Schifrin, bottom left, did a shoulder and elbow fellowship with Buzz Burkhead at the Carroll Clinic, and Durham Weeks did a sports fellowship at HSS. These different training backgrounds really provide the fellow with highly successful and proven approaches, but all very different approaches for dealing with the same complex problems. And so fellows have a lot of options for choosing what they think works best for them, a lot of different ways to solve very difficult problems in sports. You'll also notice that in terms of stage of practice, we're, in my opinion, really in the sweet spot here. None of us are too young or too green, and none of us are ready to be put out to pasture either. We're really in the middle, sort of the peak of our careers, which provides a set of perspectives for our fellows that is simultaneously cutting edge as well as wise. There are 2 additional sports faculty that I just want to mention that fellows have the option of working with here. The first is Brian Saltzman, who trained with us, did his fellowship with us, and then stayed on to head up our research endeavors as well as our Biologics Institute. He's already in the last year built a very busy sports and predominantly complex knee practice, and is fantastic to work with. He gives you a sense for what it's like just to be starting out practice. Although he does it so smoothly, he may give you a false sense of security. He's a wonderful guy to work with, and the fellows have really enjoyed popping in for cases with him on occasion. And then Natty Hammond to the right there, he did a shoulder and elbow fellowship at Wash U, followed by training in Nice, France. He has a very focused, busy, complex shoulder and elbow trauma practice, and fellows have the opportunity to spend some focused time with them if they want throughout the year. And so both of these guys are fantastic and good resources for the fellows as well. Just to focus a little bit for a second also on Dr. T. Moorman, who is chairman of the Atrium Musculoskeletal Institute here in town that we're all faculty on. T is an option for clinical rotation with the fellows, although most of his time is spent in leadership roles. He provides a unique resource for fellows, though, from a leadership perspective, and has as many connections as you can imagine throughout the nation in terms of job opportunities, so is a great resource as well. Focusing just a little bit on the primary faculty members here, this is me. I'm the fellowship director. I have a busy sports practice in both shoulder and knee, but have a particular emphasis on complex knee and cartilage restoration. So probably 60 to 70% of my practice is composed of multiligamentous knee reconstructions or revision ligament reconstructions, and with all the attendant structural issues that go with those cases, including meniscal transplantation, cartilage transplantation, and periarticular osteotomies. I take care of several local colleges, a private high school here in town, as well as a semi-pro football team, and act as a U.S. Olympic Team Network physician. Pat Connor, shown here, has a very unique practice. He did, as I noted before, a shoulder and elbow fellowship at Columbia with additional specific shoulder and elbow training at the Mayo Clinic, and he has a very busy combined shoulder and elbow as well as sports practice. He's also the head team physician for the Carolina Panthers and the Charlotte Knights, a White Sox AAA affiliate team, and acts as head team physician for Joe Gibbs Racing in the NASCAR system here. Additionally, he serves as chief of sports medicine at our Musculoskeletal Institute. So a lot of opportunities and resources for the fellow with Pat in terms of complex shoulder as well as basic sports, professional team coverage, as well as leadership roles. Jim Fleischle, shown here, he trained with Jim Andrews at ASMI, as I mentioned before. He's really the one most responsible for taking the fellowship to where it is currently, having served as fellowship director over the last decade. His practice clinically is very similar to mine in that it focuses largely on complex knee, multiligamentous knee reconstruction, and cartilage restoration. And he takes care of several local high schools, is a team physician for the Knights as well as for NASCAR. Shad Schifrin, shown here, he's a shoulder and elbow fellowship trained surgeon. He trained with Buzz Burkett at the Carroll Clinic and has an exclusively complex shoulder and elbow practice, including complex open revision stabilizations, primary and revision conventional and reverse arthroplasty. But he also takes care of one of the most prestigious local high schools in town, and so has both a complex shoulder perspective, but also still delves into sports. Durham Weeks is our fifth faculty member here. Durham did the HSS Sports Fellowship and is our resident hip guy. He has, over the last number of years, built one of the busiest hip practices in the country, focusing 70% roughly on the hip in his practice. He also has a very busy bread and butter sports practice. He is a team physician for the Panthers with Pat and also serves as a head team physician for Davidson College. And he has an additional interest in biologics in his practice, which provides the fellows additional exposure there. Our sixth and final faculty member, and also the newest addition to our group, is Jonathan Rebo. He joins us from Duke, where he'd been a faculty attending for the previous 6 years, and his chief focus with us is pediatric sports, particularly knee ligament reconstruction and cartilage restoration in skeletally immature patients. But he's also very rapidly built a busy complex knee practice, including cartilage restoration and multiligamentous knee reconstruction in adults, and is one of the team physicians at Davidson College with Durham. And so if you look at all those faculty members together, that's all six of us. So Connor and Schifrin have the complex shoulder base covered very effectively with additional options for working with Natty Hammond. Fleischle, Rebo, and I have the complex knee focus built in for you, along with pediatric sports, and with the biologics through optional exposure with Saltzman, and then Durham rounds things out with the hip exposure. So we think we got all our bases really well covered. These are our current fellows: Alex Bitzer from Hopkins, Dan Hurwitz from HSS, and Julian Sonnenfeld from Columbia. And these guys are rock stars we're having a terrific time this year with them, and I think they're really starting to hit their stride now. Can't wait for the second half of the year. So this is what our program looks like. So we've been ACGME accredited since 2010, and we believe in a mentorship model. So a one-on-one faculty to fellow ratio. There's no resident overlap. And we basically have it designed so you have 2 rotations with each of the 4 attendings that do complex knee or complex shoulder. So it's a 1-month rotation at the beginning of the year, and then a 2-month rotation where you come back in the second half of the year. And then a 1-month rotation with Durham, the 5th attending, during the second half of the year. This gives you a high volume of bread and butter cases with niche experience in these complex areas, which we talked about: complex shoulder and elbow, open shoulder revision, arthroplasty, complex knee, and hip arthroscopy. But there's flexibility built into the system. So each week throughout the year, we allow the fellow to pick a case that's with a different attending, any attending in the sports center actually, to leave the service they're on and go experience that case, which lets you kind of fill in any potential gaps that you might have prior to that in terms of covering the really unicorn-like cases. And then there's a tailored emphasis that's allowed that we promote and encourage you guys to take advantage of in the second half of the year, where you can hone the experience depending on what your practice needs. So if you have a practice that really wants you to do hip, you can spend extra months with Durham. If you need more complex knee, with me or Jim, or complex shoulder with Shad or Pat. In terms of academics, we really take an approach which is focused and prioritizes your education. So in terms of research, I think we have a very balanced and non-overwhelming requirement here. We have the resources that would allow you to publish probably 50+ papers a year if you wanted to, but we don't really believe that's necessary for your education. We think you can build proficiency in research just doing a couple of well-designed, high-quality projects that will contribute to the literature. And we give you a lot of help to do that with. So you have protected research time each week. We have a research institute at OrthoCarolina that assists with all aspects of study, design, and implementation, and a motivated, top-notch orthopedic residency that helps with the legwork. Didactically, the same themes apply. So we have a faculty sports lecture series that covers all the essentials of sports medicine. We have adopted the AOA Transition to Practice lecture series to help you with the nuts and bolts of getting into your practice, coding, billing, even passing your oral boards. And we have a weekly Indications, M&M Journal Club, and Fellows Conference rotation that covers the nuances of when and when not to operate and how to manage complications. There are also monthly arthroscopic and open cadaveric labs that allow you to hone your skills. And we send fellows to 3 meetings a year. So all 3 fellows go together at the NFL Combines and then the Academy, and you can pick a 3rd meeting, any meeting of your choice.
Second feature that
Obviously,
I think
lots of options there. These are some that fellows have taken advantage of in prior years and really gotten a lot out of. So that's the academic experience. Again, it's all focused on optimizing the educational experience of the fellow. Clinically, we really have a priority and a tailored exposure designed to allow you to succeed in any practice environment you may encounter. So we achieve that with a high volume of sports. Our 2019 numbers for our faculty were in the neighborhood of 330, 340 cuff repairs, about 250 ACLs. But we also do a high volume of complex cases. So in the neighborhood of 50 to 60 multi-ligs a year, about 50 periarticular osteotomies, and several dozen OC grafts. And our complex shoulder and elbow faculty regularly above 250 arthroplasties, with 31 revisions in 2019. And Durham crushed it this past year with over 200 labral repairs and 234 femoroplasties. So a lot of volume in terms of bread and butter as well as complexity. These are our fellow case volumes for this past year. Now, COVID did decrease the numbers a bit. I think you'd find, though, that the numbers are still very, very respectable for our fellows compared to other programs. Our 3 fellows all surpassing 500 cases. Normally, in non-COVID years, which is shown over to the right here, our fellows typically get in the 600 to 700 case range. If you look at the case distribution, which again is lower but proportional in terms of the distribution of cases, our fellows this past year each did about 80 cuff repairs, 50 ACLs, in the neighborhood of 80 total shoulders, with about a dozen revision arthroplasties, a large number of open stabilizations with Latarjets and bone block reconstructions, and a respectable quantity of multi-legs, periarticular osteotomies, and cartilage transplants with a reasonable distribution of elbow and hip arthroscopy. So a good distribution of bread and butter as well as complex cases. In terms of team coverage, we have the same approach to team coverage that we do to research. We want you to have a balanced exposure that allows you to be successful. And so we expose the fellows here to high school, college, and professional teams, but not in an overwhelming way. We don't think you need to be covering sports at all hours of the night during the week. We think that you can focus the experience and get out of it what you need. You can cover as much as you want, and there are a litany of different options at all levels that you can take advantage of if you want, but we think that for your education, it doesn't need to be excessive. Another option available to fellows come 2021 is that Major League Soccer is coming to Charlotte, so we'll have another option on the professional front for you, but again, just an option. In terms of this final feature, I think this is one of the neat and very special features to this program. We really have prioritized preparing our fellows to be as well prepared for entering their practices as they can. And one of the toughest things about leaving your training and going into practice is becoming comfortable with being the surgeon to whom the buck stops. It's a very tough thing, and it takes a heavy toll on you and your family if you're not prepared for it. And just like everything in life that's difficult, the best way to prepare for it is to be exposed to it gradually when it doesn't matter, so that when it actually does matter, you're ready. And so we've intentionally built into the fellowship program a progressive autonomy experience that covers all aspects of your practice. And there's a base level of this. None of this helps our practices. This is all for the fellows, and you can take more advantage of it if you want to, or you can just do the baseline. So in the office and in the operating room, we have a clinic called the Myers Park Clinic where fellows function as the attending. And you can book cases from that clinic, and you are the attending of record. And you'll have backup with your fellowship faculty if you need it, just like you would with your partners in practice. But it allows you to spread your wings and really get a feel for what it's like to be the one who's ultimately responsible. So office and OR experience, there's a team coverage, autonomous experience as well. All fellows are head team physician for a local high school throughout their year. And any cases you see as head team physician, you also can book as the attending. And the last component involves a component of practice that we all have, which is call. There's the option here, and it is optional, to take paid level 3. It's really like level 20 ER call, really not that taxing, but gives you another element to your practice. Again, trying to give you guys as many dimensions to being ready for your practice as possible, so that when you start practice on day one, you can really cook it. We have a reimbursement policy here, which is typical for accredited programs. We cover travel and cell phone costs, as well as there's an educational allowance and moving expense reimbursement that's standard. And ultimately, I think if you take all those components together, we're very proud of the program we have here. We have a unique clinical environment with a very high volume of both bread and butter and complex cases. Our faculty gives diverse perspectives and really cares about the fellow who's training you for the right reasons, and have produced a program that is fellow first academically and is tailored to give you a clinical exposure that will allow you to succeed and lead in any practice environment you want to join. And this is a map of all our graduates over the past decade, and you can see we canvassed the geography of the United States, and I can tell you the whole gamut of practice types is represented here: private practice, private academic, and academic. Thanks so much for paying attention here to all this, and we're open to any questions you may have. Best wishes in this application period. Please reach out if you have any additional questions.